said hi to each other before.
Good evening, Dr. Torsha and
Hello, ma'am. Hello, sir.
Raja.
are we live?
Yes, sir, we're going to live. Yes, sir, we're going to live.
Hello, sir. Am I audible, sir?
Yeah, you are.
Yeah, okay.
Should we start?
It says this meeting is being live streamed,
Yeah.
Dr. Shiv.
So, yeah, a very welcome to all of you. A very warm welcome to all of you who have joined together for this uh, awareness program. So, this is a very important topic. We have a task force for diabetes in pregnancy. I think we need to, there is some echo. Arifa, could you please check? Yeah. So, sorry for that. So, a very warm welcome to all of you who have joined for this. Should we be starting, Arifa? Okay, I think we are live right now, and a very warm welcome to all of you who have joined for this uh, uh, program on awareness program on on weight management during pregnancy. So we have have a task force of diabetes in pregnancy from Endocrine Society of India, and so we do this awareness programs once every 2 months, and we are going to discuss a very important topic, that is weight management in pregnancy, because it has multiple implications. So it has implications not only for the current pregnancy, but it has implications and consequences for the future of the mother, and in terms of development of diabetes, cardiovascular disease, and also many people might not be aware that there are important consequences for for the baby also who is going to be born, because if somebody has excess weight, that can actually translate to even future complications for the baby. So that is something we wanted to, we wanted to share all this information with you. And to talk more about it, we have a very distinguished panel of endocrinologists with us. A very warm welcome to Dr. Sheila Sheikh. She is a senior consultant at Saifi Hospital, Mumbai, and she is also the vice president of SEFIs, or that is the Society, South Asian Federation of Endocrine Societies. We have also with us Dr. Umakant Mahapatro. He is a consultant endocrinologist at Midnapur. He is very busy organizing a satellite symposium which is going to come up on 15th of March in Midnapur. So, Dr. Umakanto, welcome to the awareness program. And we have a very young and dynamic and beautiful endocrinologist, Dr. Torsha. Very warm welcome, Dr. Torsha. I think she did her residency from Sri Gangaram, from Sir Gangaram Hospital, and she is now practicing as a consultant endocrinology in Narayana Health in Kolkata. A very warm welcome to all the three panelists. They're all very experienced endocrinologists, and without much more ado, I will move on to the questions, which, and we are trying to be as practical and relate to you as closely in a practical way as possible. So, Dr. Sheila, if we start with you, So why is achieving an healthy weight before pregnancy important for the mother? So what are the implications for mother?
There are many implications, Saptarshi, but one most importantly, if the mother is obese, it increases the risk of her having gestational diabetes, which we know is a very big problem, increases the risk of gestational hypertension. Along with this associated, there's an increased risk of cesarean sections, difficult failure to progression as far as labor is concerned. And most importantly, as you rightly said, it has also implications for the next generation. There are
Right.
lots and lots of reasons why you need to be at a optimum weight before you plan pregnancy.
Thank you so much, Dr. Shelaf. So that was quite specific that there are multiple implications. So it's important that we should, the mother should be targeting for a optimum weight before conceiving. Dr. Umakanto, if we now move on to you. So if somebody is overweight or having excess weight or is actually obese, so does that also impair the fertility potential? Can it cause problem related to fertility or conceiving?
The quality of ovum and its implantation in uterus is weight sensitive. So obesity is associated with increased risk of subfertility, both in normal conception as well as assisted conception. So the pre-pregnancy BMI should be below 23, and 5 to 10% weight loss in overweight or obese women increases the chance of fertility both in normal as well as assisted conception.
So thank you, Dr. Umakanto. So what he told is that weight decreases the fertility potential, and if you also lose weight, that increases the chance of becoming pregnant. So very important message for all of you who have joined today. Now, Dr. Tosha, if we move on to you, so so as of now, if you see the social media is full of like news related to the new weight loss medications, the GLP-1 analogs, and also we know that diet and lifestyle changes they have remained the cornerstone of weight management for a very very long time. So, what is the best way to lose weight, specifically if somebody is planning to conceive?
Right. So the best approach will be a structured lifestyle program. It should combine both diet and exercise.
Right.
Diet should be calorie appropriate, it should be protein rich and well balanced. And the exercise should consist of both aerobic exercise and strength training exercise. Medicines for weight loss can also be used in selected women. However, it should be done under medical supervision and it should be stopped before the patient wishes to conceive.
So thank you, Dr. Tosha, for a very specific and precise answer that lifestyle is the preferred way, but in select cases you can consider weight loss medications, but there are definite guidelines. You have to stop that 1 to 2 months before before you plan to conceive. So, Dr. Sheila, if we move on to now to the next question. So, if we so we are discussing about pre-pregnancy now. We are discussing about weight management during pregnancy itself. So, how much weight gain is actually considered normal? So we have all our so many of these of people who are pregnant, they come and tell, okay, I'm not gaining weight, my baby is not growing, so it's a major cause for concern. There are others who gain a lot of weight. So what is normal?
There's nothing like a normal Saptashi. It all depends upon what your weight is like pre-pregnancy. And that's the reason I think it's very important that your optimum weight before pregnancy. Your weight gain will depend on your pre-pregnancy BMI. For example, if you are normal, if your weight is absolutely normal, then a weight gain of almost 12 to 16 kgs is also allowed. But if you are overweight or obese, then maybe a weight gain of only 5 to 6 kgs would be appropriate for you to have a healthy baby and at the same time not have to deal with the consequences of being overweight. And so it's very important that it is individualized. There's nothing like an absolute hard and fast rule as to how much weight you would gain, but according to your pre-pregnancy BMI and weight, you would decide how much weight gain is appropriate for your pregnancy.
So just to give a perspective, maybe somebody is having a BMI of say 22 or 21, which is like the optimum BMI. So how much weight gain should be considered as normal?
See, the weight gain in the first, again, it varies from trimester to trimester. In the first trimester, weight gain up to 2 kgs is fine. And then from the second trimester onwards, we say a weight gain of about 0.5 kg per week is absolutely allowed. So if I look at it that way, it would be approximately, say, 12.5 to 16 kg is also okay with that kind of BMI. And then according to different BMIs, we would again look at it in an appropriate way.
So if somebody is overweight, so they should be gaining less weight, and if somebody is
Definitely.
underweight, she might be requiring to
Definitely.
gain more weight.
Yep.
So, Dr. Kant, if you could, so one of the confusion that remains is that okay, somebody is pregnant and somebody, in some situations we do advise bed rest for the mother, so those are special circumstances where the call has to be primarily taken by the gynecologist or the obstetrician who is dealing it. But in all other cases, if it's like a normal pregnancy, so is exercise okay, and if it's okay, what type of exercise should be advised?
So exercise is an integral part of management of obesity during pregnancy. Exercise include aerobic exercise, anaerobic or resistance exercise, and yoga. Aerobic exercise is either moderate intensity exercise like walking or swimming, and vigorous intensity exercise like jogging or running. Moderate intensity exercise is most appropriate exercise during pregnancy. Walking for half an hour to 1 hour daily is the best modality of exercise during pregnancy. Simply lifting up lightweight dumbbell, simply pushing the walls with hands, or simply pushing the legs with the wall in supine position are appropriate anaerobic exercise during pregnancy. But some exercise should be avoided during pregnancy, like lifting of heavy weight, any supine exercise beyond 20 weeks of gestation, as gravid uterus will compress the inferior vena cava. Any exercise that increases chance of trauma to abdomen and increases chance to fall. Yoga, an ancient Indian practice, is gaining more importance. In contrary to common belief, exercise during pregnancy is beneficial, no harm. So appropriate exercise in appropriate environment is appropriate for pregnancy.
Thank you for clarifying a very complicated topic in a very simple way. So, Dr. Tosha, I think the other aspect of weight management is obviously diet. So, and it has been a tradition that if somebody is pregnant, so everybody ensures that person is eating the diet with the highest amount of calories. So, does it still hold true or relevant in the current context where we have pre-pregnancy obesity sometimes as a major comorbidity associated with all this? So, what is the right diet, and are the traditional calorie dense food still okay in today's context?
So it is a misconception that when you're pregnant, you need to eat for two people. So the quality of the food matters more, and the food should be nutrient rich. It should have enough fiber, protein, folate, iron. So yes, just taking excessive calories, unnecessary calories will only lead to excessive weight gain, which will increase the chances of developing gestational diabetes and hypertension throughout pregnancy.
Right. So you need to eat scientifically. You get a nutrition consult, talk to your doctor, talk to your endocrinologist, and whatever is the right food. Also talk to your gynecologist. She will be also able to guide you. Whatever is a you need to eat more, but you also need to eat scientifically. And eating excess
Correct.
sweets and excess fat is not always going to help. Dr. Sheila, if we now move on to the next question. So now we discussed about uh, pre-conception or pre-pregnancy weight issues. Then we discussed about pregnancy. Now will also a very vital time is the post-pregnancy time, where some people lose weight, some people don't lose weight, and so why is postpartum period so critical for long term weight control? And does breastfeeding, it sometimes it gets difficult in today's world, so the mother is actually not able to do it, so because of work constraints. So how important it is that we should ensure that the child is exclusively breastfed for initial 4 to 6 months?
Saptashi, postpartum weight loss is actually very difficult, not very easy. As you rightly said, when women are balancing so much, looking after a baby, balancing maybe household chores, and so much more on the plate, maybe working, It may not be the easiest thing to do on planet Earth in the present situation, but yes, it's something very, very important, because that weight gain, even if, for example, even 4 to 5 kg sticks on, that is going to translate into long-term cardiometabolic risk for you, be it hypertension, be it diabetes, be it whatever kind of, metabolic risk you look at. Having said that, I think since we are talking to people out there, it's all those laddus and all those, all those high caloric foods which are supposed to be nutritious for a mother, I think are strictly avoidable. Very, very important message, which the first thing after delivery the person will ask me is, ma'am, can I have all those laddus, which I'm sure everywhere in our country are very, very famous. As far as breastfeeding is concerned, I think it is a very, very important way of connecting with the baby, and with that it does help you, moderately help you with weight loss. And it is, and as Tosha rightly said, of course, during the entire process, eat healthy, eat nutritious, so that you get the benefit of the breastfeeding, which does definitely help you with further weight loss, because that does require extra calories, as we all know.
So I think you raised very important points. So it's whatever somebody had been doing in pregnancy or earlier. So just because somebody is lactating and breastfeeding the baby does not mean you require a lot of laddus and all those things. So you need to be mindful about how you are eating. In today's world, things have changed. Earlier, people were actually calorie deficient. Now, most of us are calorie surplus. Obesity is becoming more of a problem than undernutrition. So we things have changed and we have to change ourselves accordingly. Dr. Umakanto, if we now discuss, so is dieting, so again we know that the calorie requirement increases during lactation or breastfeeding. So is dieting recommended at that particular time?
Is during pre-pregnancy and postpartum period is the ideal time for management of obesity. Between 6 weeks to 6 months after delivery, 5 to 10% of body weight should be lost in overweight and obese women, and this target can be achieved with a weight loss of 0.5 to 1 kg per month. So pre-pregnancy body weight should be achieved within 6 months to 1 year after delivery. In contrary to common myth, obesity delays initiation and maintenance of breastfeeding, but weight loss in overweight and obese women improves the quality as well as quantity of breast milk.
Thank you, Dr. Umakanto. So we will now ask the last question of the panel discussion. Then we'll have a very rapid fire round where we are going to ask very brief questions to the all the three panelists. So Dr. Torsha, so we started with that fact that so it's not only about the mother. So if the child is also a child also gets affected if the mother is overweight or obese. So, what is the science behind that and how important it is in today's context?
So obesity in the mother actually exposes the fetus to a surplus of calories and glucose. So it changes the way that the baby should be handling sugar later in life, and also increases the chance of storing fat. So it increases the lifetime risk of developing obesity and diabetes in the child. So
Right,
it
and
should be
also the
treated.
cardiovascular disease risk
Yes.
also increases. Right.
Increases all metabolic risk factors, and so previous to pregnancy and during pregnancy, the weight should be managed.
So we move on to a rapid fire round. So and so I think we'll start with Torsha. So if so, one test every woman should consider before planning pregnancy.
Either one can go for a fasting blood glucose or an HbA1c to assess the baseline metabolic risk factors.
And one lifestyle habit to start early.
One should start exercising early, at least moderate intensity exercise, 150 minutes per week, comprising of both aerobic and strength training exercise.
One mistake to avoid before pregnancy.
One should avoid crash dieting and unsupervised weight loss supplements.
One target to remember before pregnancy.
Even 5 to 10% of weight loss goes a long way in improving the fertility and pregnancy outcome.
So that was amazing. Torsha, we move on to Umakanto right now. So
Yeah.
during pregnancy, one thing to monitor regularly.
So this is body weight should be regularly monitored.
Yeah. And one dietary focus.
So adequate protein, 1 to 1.2 gram per kg body weight, along with micronutrient, and fiber.
And one warning sign not to ignore.
So excessive weight gain, more than 16 kg in normal weight women, more than 11.5 kg in overweight women, and more than 9 kg in obese women are the warning sign of pregnancy.
And one protective habit.
So aerobic exercise, anaerobic or resistance exercise, and yoga should be regularly practiced.
Thank you, Dr. Umakanta. Very brief and precise answers. That was amazing. So, Dr. Sheila, now it's your turn. And we are talking about after pregnancy right now. So, one test not to miss.
HbA1c glucose 6 to 8 weeks after pregnancy.
So
Delivery.
postpartum glucose testing. Yeah, one common challenge in
Wait,
after
wait,
pregnancy.
wait.
And one long-term goal one should be having. So people usually tend to get relaxed after so much happening with their lives.
I think optimum weight, again, keep that as a long-term goal. And
And
metabolic health.
one message for families.
Please look after your mothers in the right way.
Yeah.
Protect them, support them, take care of them.
I think we had an amazing round of discussion today. So very, very important information. So whoever who has joined for this program, please do share the link with others. So these are very important information. Is not only important for the current pregnancy, for the long term health of the mother, but also for the long term health of the child as well. So we need to prioritize weight. We need to ensure that we are taking the right type of calories, and also the mother is exercising, and it's before, after, and postpartum, and also in the long run. So everything should be kept in mind. So whenever you go lax, so you miss out on so many things to uh, get your health on track. So thank you very much today once again for being with us. My sincere thanks to all the three panelists, Dr. Sheila, Dr. Umakanto, and Dr. Torsha. Thank you for connecting with all our audiences who I believe that that they must have, they might have got benefited from uh, whatever we discussed today related to weight and pregnancy. And we look forward to again connecting with you every, we do it like every 2 months on an Wednesday towards the end of the month. So this is an initiative of the Diabetes in Pregnancy Task Force of Endocrine Society of India. And if you have any more problems, any such queries, so do connect with us through the Endocrine Society of India webpage platform, and keep on staying healthy. Eat the right diet, keep on exercising, and do keep a track on your weight, because it is linked to multiple complications. Thank you once again for joining. A very, very sincere thanks from all of us to all of you.
Thank you.
Thank you. Thank you very much. Thanks, Dr. Saptarshi, and thanks to my Tosha and Dr. Umakanta.
Thank you, madam. Thank you, Dosha. Thank you, Dr.
Thank
Saptarshi.
you. Thank you. Thank you. Thank you.